All right. Hi, everybody. This is Annalie Kruger, the owner of Care Right Incorporated. We help families across the United States develop an aging plan. What is an aging plan? We work with families to determine what's working well right now with your current situation, what's not working well with your current situation, what supports do you need to make your life better and easier, how is your family holding up with this whole aging process, and if you need care, who's going to provide the care and how is that care going to get paid? And where should you think about living short term and long term? So, as you know, with the world of families living apart from each other, we often have this conversation of, okay, mom lives in one state, dad lives in a different state, and all their kids live in 4 different states. So it's really a matter of discussing where does it make sense for you as a parent to live short term and long term, and how can we help the family navigate these murky waters of aging. So today I have Kristin Tassel as my guest speaker today. She is with Informed Choice. She works with families looking at Medicare solutions. So Kristin, welcome to the Care Right podcast today. Can you introduce
Thank
yourself
you.
a little bit? You're welcome.
Yeah, like Annalie said, thank you so much for having me today. I am Kristin Tassel, and I'm a Medicare consultant for Informed Choice Insurance Agency. And what we are is a full-service Medicare insurance agency that starts with education and ends with product placement. We assist individuals that are aging onto Medicare or already on Medicare with evaluating their options all throughout Southwest Florida. Individuals that we assist that we can help them with plan product knowledge and information is claiming residency in Florida, Wisconsin, or Pennsylvania.
Good, good.
Yeah.
So anybody in Florida, Wisconsin, or Pennsylvania, you can
Exactly.
assist.
Yep,
Okay,
absolutely. Yep, they can
good.
always come to our educational events, but if they wanted assistance with the plan product of changing of plans, whether it be medical or prescription drugs or both, they would need to claim their residency in one of those 3 states. So.
Okay, good.
Mhm.
And why informed choice? Tell me about informed choice, and what could someone expect to gain by working with someone with your company?
Absolutely. So with Informed Choice, individuals that are going on to Medicare or even already on Medicare, every year they're getting bombarded with a lot of information. And what we do at Informed Choice is a little bit different. So I am a salaried Medicare consultant. What that means is I'm non-commissioned. So that means there's no incentivizing for me to place you in a certain product or a certain plan. So being salaried, that allows us to really inform you of your best options every single time. Our best interest is your best interest. Second and more important reason to a lot of individuals is we are absolutely no cost. So individuals can come in here just making sure they're sitting down and really identifying what all their options are, because we offer all the companies available for all the product options, and they can see year to year, are they making the best decision for them with no incentivizing or any type of pressure to make any types of changes. So really where we're different in the insurance market is our best interest is of the individual turning 65 or already on Medicare, being non-commissioned and absolutely being no cost.
Yeah, I think the non-commissioned piece is unique.
It is.
And it, because I can understand that. I'm fee for service, so
Mm-hmm. Mm-hmm.
that way the clients know that I have their best interest at heart. That, you know, if I make a referral to a home care company or to a facility or a retirement community,
Yeah.
there's no kickback. There's no financial relationship or exchange of money either. And I think that says a lot, because then you are client focused versus commission focused.
That's another thing, and that's a great point too. So kind of where we start is education. So where individuals are being bombarded with information, they're a lot of times kind of pulled in a lot of different directions. What does my friends have? What do my family members have? By us being able to educate them on the Medicare program, and then looking at their options, that's just a whole different angle that a lot of other agencies, they just can't take with the individual. So.
And I just wanted to touch on something that you just said, because I don't know about you, but I know when I'm working with families, sometimes need to educate people on the value of working with a professional to help them navigate, instead
Mhm.
of listening to, well, my neighbor Joe does this and this is how he handled it. Well, Joe's situation is probably entirely different than yours, right?
Exactly.
So
It's really important to look at your own situation, not a family member's, not a friend's, because where something might be great for them, it might be completely missing the ball for you. So that's why every year you want to be looking to make sure that you're doing the best for your health with the coverage options that you choose.
Exactly. One of the questions I have for you is, do I have to go on to Medicare when I turn 65?
Common question. That is not a yes or no question, unfortunately, I'm sorry, but it really depends on your situation. So a lot of individuals, they're still working at 65. They still maybe have employer coverage, or maybe their spouse is still working and they have coverage that way. The way it works with Medicare is, as long as you have credible coverage or as good as Medicare hospital, doctor, and drug coverage, you may not need to go on to Medicare right away. But don't just listen to that and not check into it. You want to give us a call and make sure that you are either deferring Medicare at the right time, or you do need to go on it, because Medicare, the federal government, does penalize you if you don't go on to full Medicare and prescription drug in the time frame that you're required to. And that penalty, unfortunately, is for the rest of your life.
Right. I don't think a lot of people realize that.
They don't. And that's a big thing with starting with education, is making sure individuals understand what Medicare is, what Medicare doesn't cover. When it started in 1965, it was not meant to cover everything, and there is a cost associated with it. So it's important to start from square one to learn about what you're going into. A lot of times it's the first time individuals are having to make a decision on their own health coverage.
Right. And I know when I meet with families, most of what I do, or a lot of what I do, a lot of the time I spend with the families is just education. Because 9 times out of 10, when we're talking about the aging plan and if you need care, who's going to provide the care, how's that going to get paid, if you have to move into an assisted living or a rehab center or a nursing home, 9 times out of 10, unfortunately, families and their adult children just assume that Medicare pays for everything. And so the value of putting that aging plan together with your mom and dad, or with mom and dad, is also education for that next generation, so that those kids who are usually my age, in their 40s, 50s, and 60s, can start to plan better and make more informed decisions, instead of assuming that Medicare is going to pay for things, because it does not.
Exactly.
So it is not one of your retirement buckets.
It is not.
With your retirement planning.
Right.
So
it is not.
What is there a cost to Medicare? Is it free?
Yeah, that is probably one of the most popular questions that we get. A lot of individuals, they're aware that they're paying for Medicare while they're working. You actually pay a Medicare tax while you're working, and that will pay for some of Medicare, but not all of it. And so to answer your question, is Medicare free? No, it's not free. The Medicare premium is based on your income from 2 years prior. And it is a household income. Even if your spouse is not on Medicare, it is still looking at the household income. That can change every year, what that cost is going to be. It'll either come out of your Social Security check, or you'll owe it quarterly to Medicare in the form of a check when they bill you. So to answer your question, Ellie, Medicare is not free. It never will be free. It does keep going up in costs, and there is a lot of out-of-pocket associated with not just only the premium, but the out-of-pocket of co-pays and deductibles and things like that.
Yeah, it's very, and one of the reasons I'm glad we met is because when clients come to me, or when families come to me and I do their assessment and their family meeting, just to kind of get a sense of where are you with your planning and all those kind of things, all of these things are checklists that I go over with my clients, and I can't be everything to everyone, and so I have a whole trusted network of professionals that I lean on for my clients and refer my clients to, because I'm not a licensed insurance person, and Medicare is, it's so complex that unless you're in that industry, I mean, that's why I like to meet with people and build that network, because it's way more complicated than the general public thinks that it is.
Absolutely. It's
How,
part of our regulations, not to interrupt you, Annalie, but we have certifying every single year with not only the companies that we offer, but just Medicare in general. So you're right, it's an ever-changing market, and you need to have that partnership with a professional, just like we have with you, to be able to know, where to send individuals to get the best advice for their, their questions.
exactly, exactly. How soon should I be looking at my options that are available to me?
Well, I do say that for individuals that are turning 65, first going on to Medicare, it's probably the one and only time you're going to feel like the paparazzi is after you. It is nonstop. You are going to get phone calls. You're going to get emails. You're going to get letters. You are going to get mailings. I would say when you're comfortable to start looking at it, you're probably going to get bombarded right around a year before turning 65, sometimes a year and a half before. We offer free Medicare educational seminars. That's where most individuals start, is coming to these types of seminars to learn about the Medicare program and then what types of options are available to them. So to answer your question about when should I start looking at my options, I would say a year out, 6 months out. The earliest you can make a decision is 3 months before you go on to Medicare. I would not wait that long. Most people don't, some do, but I would say give yourself some time, because what you're receiving in the mail and the phone calls that you're getting is just about the actual plans. It has nothing to do with the education of the program of Medicare and what you're actually trying to protect yourself from. So I would say as soon as you're comfortable, 6 months to a year out, turning 65 or going on to Medicare, retiring from that job, go ahead, give us a call or work with your dedicated professional to help you with your Medicare options.
And how would someone reach out to you? Do you have a website and a phone number, or how would they reach you?
Absolutely. I was going to put my card up here, but you can't really see it. So Informed Choice Insurance Agency, you can give me a call. I can go ahead and give you my number. It's 239-208-7090. You ask for Kristin. I'm the only one here. Otherwise, you can stop in at our office, which is 13620 Metropolis Avenue in Fort Myers. We can also come to you. We're all Southwest Florida. That's where I'm located, in Fort Myers. But we have communities throughout Southwest Florida that allow us to do presentations and things like that to come to you. So wherever you're located, just give us a call. We'd be happy to discuss your situation and see what we can do to help you.
Excellent. And then do you have a website too, or is what's your website?
Yeah, it is. So it's informedchoice.com.
Okay, so good. Yeah. Very good. So Kristin, is there any other tidbit of information that you'd want to pass along, or is it just best if they call you and set up a time to maybe talk with you and see what's the best solution for them?
I would say the biggest thing is don't get too overwhelmed or too frustrated. When you have a dedicated professional like yourself, Annalie, or like Informed Choice, you know that you're going to be making the best decision for you when you're comfortable and confident in that. It's important to have those areas you can go to, because we are going to be able to walk you through the program of Medicare and your best options available to you. It is a very, very important decision, and it's something to think about long-term, not just short-term. We can get into that with the way that the Affordable Care Act isn't part of the Medicare program. I would say start with picking up the phone and giving us a call, or anyone else that you trust to be able to help you with your Medicare options. And know that you're not alone in it. There's, I believe, 10,000 baby boomers turning 65 every single day. So
Right. There's quite a few.
Yes. A lot of them are here right now.
That's right. So. Well, good. Well, just in closing, this is Annalie Kruger, the owner of Care Right Incorporated. My website is www.carerightinc.com. That's CARERIGHTINC.com. If you have aging loved ones, or if you're a senior and you want to explore what some of your options can be for home care, or moving into communities and helping to make sure that your family relationships stay intact through this whole aging process, and you're ready to put a plan together, then you would want to reach out to me. You can, again, reach me on my website, www.carerightinc.com, or you can also call me at 239-770-6322. I'm nationwide. So anyone in any state can give me a jingle. Kristin, one more time, your website and best contact number.
Yep, so the website for Informed Choice is www.informedchoice.com. My phone that you can reach me is the local number here in Fort Myers is 239-208-7090. And ask for Kristin.
And ask for Kristin. Excellent. Very good. Well, I appreciate your time today.